The big thing to remember with musculoskeletal injuries is, let's just talk about the different tissues in general. So anytime you're dealing with a joint, you've got bone. We are not bone doctors. So if there's a problem with the bone, 1 out of 1,000 patients who comes in here has an actual bone problem. The reason is bones don't heal like normal tissue, they regenerate. Like when you break a bone, the old the osteoblasts and osteoclasts revert into stem cells, regenerate the area, then seal it back up. That's why bone heals better than it was before with the increased size in the callus. And 10 years later, you can't even tell the bone was broken most of the time, as long as it's not complex. These people never come into our office. People don't come in with broken bones. You know when you have a broken bone, the pain is severe, and we wouldn't deal with it anyway. But about 1 out of every 1,000 patient that walks in the door has an actual broken bone and doesn't realize it because they have other complications. So you're just not going to see that. But when you're dealing with shoulder problem, it's either going to be the bone, which is crazy rare. They don't come to our office, so it's not a problem. Or it's going to be the cartilage. The cartilage is wore out. Now that's a big deal in the knee because it's weight bearing. The shoulder is not weight bearing, so you don't have bone on bone. The bone just hangs. So you could have like a torn labrum or a torn piece of cartilage. Again, that's really rare in the office. But what's super common is a tendon, a torn rotator cuff, the smaller muscles. Super common. And the reason that we don't usually get the acute injuries. The acute injuries where they're freshly torn, a healthy tendon gets torn, they typically go to physical therapy or they go to the ER. What we get a lot of is the chronic injuries. And tendons and ligaments, you don't have a chronic bone injury, or we don't ever see them. Ligaments and tendons are horrible at healing. And that's the key, that's the thing, that's the takeaway. Ligaments and tendons are bad healers. And remember, once you damage it, and we're talking about just a tendon. Everything I say applies to ligaments, and remember, 90% of what we do isn't tendons, it's ligaments. Now you're going to see more tendons because you're going to do shoulders. So we got to make sure you understand the 4 or the 5. There's 4 rotators plus the teres is kind of a rotator. And of those 4 rotators, so basically all you're going to have to do, memorize the 4 rotators, memorize what they do. This isn't hard. You're going to memorize what the rotators do, and you're going to learn 2 or 3 orthopedic tests on how to measure it. Because what's nice is if you've only got 4 rotators, and we know exactly what the rotator does. So if you want to know if the tendon is damaged, put pressure on that rotator. If it hurts, it's damaged. If it has limited range of motion, it's damaged. It's that easy. Then we slap an ultrasound on it, and we're going to have a book, and it's going to say, here's how you look at the biceps tendon. And it's going to say, put it here, angle it this way, here's what you're looking for. And it'll have a picture, look for this image. And you'll sit there and play with it till you find the image. And then you'll go, there's nice continuity there, or there's irregularities. If you see irregularities, you go, bam, this is the problem. But remember, you don't even need to do that, because by the time they've told you how did you hurt it, we'll go through the mechanism of injury and what their symptoms are. You're already going to be 90% certain, then you're going to let me test it. Boom, that hurts. I want to test the biceps tendon. Okay, push right here. I'm going to push right here and poke. You're going to jump. Now I know what it is. So like I said, and they should already know. So they'll walk into the room and they'll say, yep, I got pain right here. Well, you're pointing to the bicep tendon. Or they may say this general area. And what makes it hurt? Well, it hurts when I'm drinking my coffee in the morning, or it hurts when I go to pick something up, or it hurts when I move this way. That sounds like the biceps tendon. Okay, hold your arm like this, I'm going to push down. Does that hurt? Yeah, that hurts. You see? Then you got to go and let's rule it out. What else could it be in this area? Oh, we could check the pec major, we could check the brachioradialis. Let's rule those out. They may still be tender though, because the whole area will be inflamed. Then you're going to go, so that's literally how it's 5 minutes. And you'll have a good, safe understanding of it. And then you're going to go, let's make sure, let's throw the ultrasound unit on it and see if we can see it. And then you're going to go, you know what? I don't see any irregularities. It looks like this is a relatively minor tear. Remember though, there's 2 different ways you can tear a ligament or a tendon. One is just a big straight rip across it, but just as likely could be a tear here, and a tear here. So 50, 60% of the time, you will not see it on the ultrasound. And you just look at the patient and go, you know what? It's definitely torn, but I'm not seeing any big obvious tears, which means you're going to respond really good.
PRP.
Yeah, even if it is torn, as long as it's, if you see like a 75% tear, it depends on how functional too. Remember,
Right,
they say your exam, you're gonna sit there and if you put a half a pound and they go, oh, that's killing me, versus, oh, it hurts, I can do it, but it hurts. You're gonna know. You know, you're gonna be able to sit there and go, the supraspinatus, I can't bend it outwards, you know, or they can't do it at all. And if you have, the nice thing is if you go, you know, I know it's wrong, I can tell, look the patient in the eye and say, this is definitely, see, and that's your job. Once you figure out what's wrong, you double check, you do differential diagnosis. You know, like I said, this can take, you could literally do this in about 10 minutes. Then you got to sit down with them and go, hey, it's definitely your supraspinatus, but you know what, that ultrasound, that's a pretty big tear. I think PRP is going to work really good, but because it's so big, you know, let's go shoot an MRI and get an orthopedic consult just to make sure. You know, and see what they say.
For sure.
Yeah, if you do, but at the same time, you can be like, you know, or you ask the patient. A lot of times I'll sit down and say, I think we're going to get good results. Actually, 90% of the time I go, I know what's wrong. This is what's wrong. I know what to do. This is what we're going to do. Are you interested? And they go, yeah, let's do it. But about 10% of the time I go, I'm a little worried. This is a tough one. I think this is what I would do, but there's a chance this won't work because it may just be too deep. So if it was me, I'd go ahead and do the PRP, do the rehab. There's no contraindication. The worst thing that's going to happen is you're going to get bad results. And that's because it's a pretty deep tear. And if you get bad results with me, then we're going to send you to the orthopedist and they're going to consider doing surgery. Now, here's your decision. You don't have to spend $2,000 or $3,000 or $4,000 doing all this rehab, doing all the PRP, doing stem cells, and then you might just end up doing surgery anyway. If you did, that's actually a good thing because you'll respond better to surgery by rehabilitating the area pre-surgery. That actually does, it makes it stronger and better and it responds better. But you're risking $3,000 or $4,000 of your own money when you could just go do surgery and fix it that way, and you save $3,000 in 2 months of time. You have those options and stuff like that, and I just tell the patient, here's what I would do. Here's your options. What do you want to do? And 9 times out of 10, they'll still say, no, let's do the rehab. I don't want to talk to a surgeon yet. You know?
People don't want surgery.
Yeah. And a lot of times the only reason they'll typically do that is they'll go, well, I got to pay cash out of pocket here. We do take all the insurances and stuff, but sometimes they don't cover it. And they'll say they'll cover surgery, so let's go do surgery. So it's usually only a money issue. So, and those are things that really you shouldn't have to deal with. Your job is to go, this would work. You may, you know, I'll tell you just tell the chiropractor, this is a pretty deep tear. Surgery might be a better option. Your job is to just say, I'm here to look at your shoulder. The chiropractor said it's a supraspinatus. I absolutely agree. I think PRP would be great. There's really no contraindications for it. I'm going to let him know that. And you'll go see him next time you see him. He'll go over all this and your patient options, and hopefully I get a chance to help you. So.